Hey everyone, Prasanna here from Medax OSCE Academy. Let's dive into today's OSCE topic.
Common OSCE mistakes and how to avoid them. At Medax, we've trained hundreds of international nurses. And one thing we've learned is that most students don't fail because they don't know enough. They fail because of small, common mistakes that can be easily fixed. So today, let's talk about the most common OSCE mistakes that cost nurses their success and how you can avoid them. Skipping hand hygiene. This might sound simple, but it's one of the biggest reasons students lose marks. In OSCE, hand hygiene is not optional. It's a must. Before you touch anything, patients, equipment, or documentation, perform proper hand hygiene. Remember, it's the first impression the examiner gets, and it shows you're a safe and professional nurse. Missing ID and allergy check. Another common mistake is forgetting to check the patient's ID and allergy status. It might seem small, but in the real world, this can be a life or death step. Always confirm your patient's identity and check for allergies before any procedure. Say it out loud so the assessor hears it. That's how you gain those marks confidently. Forgetting to gain consent. We've seen this so many times. Students jump straight into the task without asking for patient consent, but communication and consent are at the heart of UK nursing practice. Before you begin, introduce yourself clearly and gain verbal consent. It shows respect, professionalism, and patient-centered care, all of which the OSCE exam is testing for. Poor communication. Now, this one's a big one. Sometimes students focus so much on performing skills that they forget to talk to their patient. Always explain what you're doing, reassure the patient, and use a calm, caring tone. At Medax OSCE Academy, we remind our students good communication is not just about words, it's about compassion. That one change can make a huge difference to your OSCE performance. Missing vital signs. Check vital signs are called vital for a reason. Skipping or rushing through them can cost you valuable marks. Make sure you complete the full vital signs assessment accurately. Pulse, temperature, blood pressure, and respiration. And don't forget to record your findings clearly at the end. Poor documentation. Documentation mistakes are more common than you think. Sometimes students finish beautifully but forget to record their findings or sign their chart. In OSCE, if it's not written, it's not done. So make sure your documents are clear, readable, and logical. Practice writing your notes during mock exams. It builds confidence and speed. Poor time management. And finally, the silent mark killer, time management. Many students run out of time before completing their station, even when they know all the steps. The solution? Practice under real-time pressure. At Medax OSCE Academy, our mock stations are timed exactly like the real exam, so you learn how to perform effectively and stay calm when the clock is ticking. Closing message. So, let's quickly recap your checklist for success. Perform proper hand hygiene. Check patient ID and allergies. Gain patient consent. Communicate clearly and kindly. Complete vital signs assessment. Document properly. Manage your time effectively. If you focus on these basics, you'll not only avoid mistakes, you'll impress your examiner with confidence and professionalism. At Medax OSCE Academy, we make sure our students master these steps through hands-on practice, real exam simulations, and expert feedback. So if you're ready to pass your NMC OSCE with confidence, join our next batch and learn the right way, the Medax way. Thank you for watching. Don't forget to like, share, and subscribe for more OSCE tips, guidance, and success stories. And remember, your OSCE journey doesn't have to be stressful when you have the right support. See you in the next video, and best of luck with your OSCE preparation.